Singapore authorities approved the Chinese-made Sinovac vaccine for emergency use earlier this month under a special access route by the private healthcare institutions. And after releasing a list of clinics authorized to administer the vaccine last week, the health centers were inundated with queries from people interested in registering for the jabs. CGTN's Miro visited one such clinic, which began vaccinating people on Friday afternoon.
62-year-old Alvin Sim could have received his Pfizer or Moderna shot back in March. But the businessman who frequently traveled to China for work decided to wait for a Chinese vaccine instead. This Monday, Alvin finally received his first dose of the Sinovac vaccine.
I took into consideration traveling to China. When Singapore's situation was stable, China was accepting Singaporean tourists. But now with the latest spike, we cannot go to China. My hope is that the Chinese government will ease entry restrictions for people with Sinovac shots.
Alvin is not alone. The 24 private clinics who have been authorized by Singapore's Ministry of Health to administer Sinovac were swamped with requests.
The minute I heard that the Chinese vaccine was available, I immediately went to register. I think American vaccines have more side effects. I trust the Chinese vaccines more.
The response has been overwhelming. We have had thousands of calls. In fact, the first call came just 2 or 3 hours after the news was announced. I expected calls of about a few hundreds, knowing that Singaporeans are very concerned, but I certainly didn't expect numbers of thousands.
The concerns that Dr. Leon is talking about are around the fact that the Pfizer, BioNTech and Moderna use the relatively new mRNA technology, which delivers the genetic code from the virus to initiate an immune response. In contrast, Sinovac uses an inactivated virus, the same technology which has been used in traditional vaccines for polio and rabies.
Many people are sitting out and they don't dare to take the mRNA vaccine. And the commonly cited reasons are, it is a new vaccine, we don't know about the technology, will that affect the body thereafter?
Singapore allowed the usage of Sinovac under a special access route earlier this month after the vaccine received emergency use approval by WHO. The city-state has a stockpile of 200,000 doses, which arrived in February of this year. The 24 private clinics will receive supplies from the government based on their ability to deliver.
More than half of Singapore's population have received at least their first dose of COVID vaccine under the National Vaccination Program, which administers Pfizer or Moderna. Medical experts said the uptake has been good, but not excellent. The expectations now are that introducing alternatives such as Sinovac would accelerate Singapore's vaccine drive. Miro, CGTN, Singapore.